Nutritional screening is essential to identify individuals at risk of malnutrition and implement appropriate care plans. The Malnutrition Universal Screening Tool, or MUST, has been validated to be used across different care settings to identify individuals aged 18 years and over who are malnourished or at risk of malnutrition. An individual should be screened on their first contact with a healthcare professional, and then upon clinical concern, or more regularly if they are found to be at risk of malnutrition. A copy of the screening tool and all of the resources referred to on this video can be found on the Western Sussex Dietitians website. There are 5 steps to calculating the MUST score. Step 1. BMI score. To complete this step, you will need patient's height, current weight. Height. Ideally, use a stadiometer to measure the patient's height. The individual should be stood upright and looking straight ahead, with shoes removed and feet flat with heels against the height stick. Measure in meters where possible, or use a height conversion chart. If you are unable to measure height, use self-reported height if reliable, use visual assessment, or consider using the ulnar length to estimate their height. To measure the ulnar length, ask the patient to place their arm across their chest to the opposite shoulder, ideally their left arm. Measure from the elbow to the midpoint of the prominent bone on the wrist and measure to the nearest ½ centimetre. Use the conversion charts which are available on our website to convert this measurement into an estimated height. Weight. Ideally, measure the patient on calibrated scales in kilograms. Where possible, use the same scales at the same time of day in similar clothing. If you are using chair or hoist scales, ensure the individual's body is not touching the bed or the floor whilst taking the measurement. If you are unable to weigh the patient, consider using mid-upper arm circumference to estimate their BMI. Please see our website or other video on instructions on how to do this. BMI. Using the weight and the height that you've measured, calculate the individual's BMI. You can use this calculation, weight in kilograms divided by their height in meters squared. Or you can use our BMI score chart on our website. A BMI of 20 or more gives a score of 0. A BMI of 18.5 to 20 scores 1. A BMI below 18.5 scores 2. Step 2. Unintentional weight loss. This determines the percentage of unintentional weight loss in the past 3 to 6 months. To calculate the percentage weight loss, you will need the individual's current weight and their highest weight from the past 3 to 6 months. Calculate percentage weight loss by using this calculation. The weight 3 to 6 months ago, take away the current weight, divided by the weight 3 to 6 months ago, times by 100. If the weight loss cannot be calculated, use your clinical judgment and visual assessment to estimate. In particular, consider loose-fitting clothes and jewellery, loose dentures, or protruding collarbones or sunken facial features as possible signs of weight loss. Weight loss score. Less than 5% scores 0. 5 to 10% weight loss scores 1. More than 10% weight loss scores 2. Step 3. The acute disease effect score. Score 2 if the individual is acutely unwell and therefore has been or is likely to have no nutritional intake for 5 days or more, as they will be at risk of malnutrition. This is unlikely to apply to individuals in the community. Step 4. Calculating the MUST score. Add the scores together to calculate the overall MUST score and the overall risk of malnutrition. Step 5. Management plan. If the score is 0, this patient is at low risk of malnutrition. Rescreen as part of your clinical care or upon concern. A score of 1 indicates that a patient is at medium risk of malnutrition. Consider the underlying cause of the malnutrition and treat and refer as appropriate. Provide our Eat Better, Feel Better leaflet and use the 1-2-3 approach to food first. Weigh and rescreen monthly. A score of 2 indicates that a patient is at high risk of malnutrition. Treat as per the guidance for medium risk, but also consider the use of over-the-counter supplement drinks such as Meritine and Complan. A score of 3 or more indicates very high risk. Discuss with the individual's GP about a trial of first-line oral nutrition supplements and a possible referral to the dietitian. Please refer to our website for further information and additional resources.